Hi everyone, it's Victoria. This is my week 4 update. I'm having a lot of trouble with my camera here, so this is my third time trying to do this. I had the lap band surgery on June 2nd, and I ended up getting a wound infection. Although I thought it was getting better, I was mistaken. On June 28th, I went to see my doctor, and the hole had gotten better, the redness had decreased, but unfortunately where the hole was, if you look deep down, you could see the port. So the port of the lap band was contaminated. So my doctor wanted to do an emergency surgery to remove the port, which I had done yesterday, June 29th. He basically went in laparoscopically, cut the port, tied off the tubing that connects to the port. When my wound infection heals, probably in about 6 weeks, 6 weeks or so after my wound infection heals, the doctor will replace the port. Just go back in laparoscopically, attach the port to the tubing after he unties it, and move the port higher up on my abdomen, stomach area. I'm just in a little discomfort now, but things are going okay. Hopefully my body does not reject the port this time around. If it does, my doctor's not going to have much of a choice but to remove the whole lap band and port, because my body just doesn't like a foreign object in my stomach area. And if that happens, he said that we could try to have the sleeve done, the bariatric surgery with the sleeve, vertical sleeve I think it's called, where they go in and they cut, I guess, the edge of your stomach to make it smaller, like a third of the size or something. And then they remove the portion that they cut out and they staple the portion that they kept in. They don't have to reroute it to your intestines, which is a good thing. But hopefully I'm not going to have to get to that point. Yeah, so I had a little bit of complications with the lap band, and I'm not going to say it's going to happen to everyone. I'm the first patient of my doctor, out of all the lap bands he's been doing, to have this specific problem. I'm not the first ever. I mean, he's talked to some doctors who have had this happen before, and when the port's, replaced again, it usually isn't a problem. But me, I'm the one with the best luck, right? So we'll see. But 6 weeks after my wound infection heals, we'll try to go for the port again. My diet hasn't really changed. I'm still on soft foods. And I still have restriction, which is good. Just unable to exercise. Lost about 22 to 20 pounds. I think I've gained 2 to 4 pounds back. It's because no exercise, and then my antibiotics have sugar in it, and the Vicodin is kind of constipating me, so I don't have a bowel movement for about 3 days. I know you don't really want to hear that, but it happens. I guess the only other complication I've had, I don't know if it's a complication, I guess it's expected to happen since I just had surgery yesterday. But in my directions to go home, it said that I had to change my dressing. They didn't really want it soaked or wet, and it was kind of soaked with blood. So I was supposed to change it how I normally was changing it, with the tape that goes inside the hole, and then you put gauze over it. Well, to my surprise and my husband's surprise, we removed the bandaging on top of the wound, just fine. And then there was like another piece of gauze there, and I started pulling it out. Turned out that the gauze was, I guess, stuck inside the wound, to kind of help with the bleeding. But I pulled it out. It didn't hurt, except it just bled everywhere, and it wasn't stopping. And so I was eventually able to stop the bleeding. We got scared. We thought we might have had to call 911 or go to the hospital. But I got it to stop. I just put a new piece of gauze in, and stuffed it in. And there's no leakage or anything, not since I changed it last night about 1 in the morning, but it's not leaking through or anything, which is good. But I did put in a call to my doctor and the nurse to see if they want me to continue packing in gauze or try my tape that I have to stick in there. I'm still waiting on a call. Yes, other than that, I'm doing okay. Let's see, I can show you what it looks like when I get home. This is where the wound infection is. As you can see, there's no blood oozing out, so that's a good thing. So I guess I packed it right. I guess they went in here, and they went in right here. But this is the part that really hurts me for some odd reason. I don't know. Yeah, but other than that, I'm doing okay. Just no strenuous activity for the next 2 weeks. I'm just kind of taking it easy. Should probably be laying down, sitting down, napping. We'll get there. My mom's doing good. She started chemo on the 28th, and they said within the first 48 hours is when you feel the effects of the chemo, and she just got very nauseous. But no vomiting, which is good. And she has 3 more treatments of chemo, so she does it once every other week, and then she will start radiation. Unfortunately, I thought it was stage 1 that she had, but she has an aggressive cancer. But it did not spread anywhere else, which is really great. It was just in her right breast, which they removed, but they wanted to do chemo just to kind of cleanse her out, and then they'll do the radiation, and I think she has to do hormone therapy. Radiation is supposed to be a lot easier than chemo, and she's supposed to be giving herself injections every day, I guess, to raise her blood count, or the white cell count, red cell count, I'm not sure specifics. But she's doing good, and I'm doing good, and we're just kind of rolling with everything. And I believe she's going to be having her hysterectomy in August, because they found that 8-centimeter cyst in her ovary. So I'll be dealing with that. I guess other than that, that's pretty much it. We're doing good. I mean, just rolling with the punches. What else can you do, right? If you have any questions or anything, please feel free to contact me. I'll be happy to answer as soon as I can, and I will be updating this, if anything changes before the week. Hopefully not. But you guys have a good afternoon, evening, whenever you read this, listen to this, see this, whatever. I will talk to you guys later.